we should probably wrap up soon, but what are some things that we should be looking for as the year moves on, or that you're looking for to know that things are going well? Over the next 6 months, what are some things that you might be looking
Things that are going on. Um, well, we'll want to see signs that the number of uninsured is coming down. That's not so easy to do. We do have the Gallup surveys on this. Is a pretty good, Gallup polls this question in their surveys, and that'll probably be our first leading indicator of that. So we'll want to see that. It's going to be a while before we have the information about access to care and can process it. With Massachusetts, it took about 2 years to get that information. The Urban Institute was studying it, and we got data later, and right. I mean, we saw very clear evidence. People got better access to care, fewer cost hardships. Wasn't a huge difference, but it was significant, and that's what you want to look for.
Of course, Massachusetts was starting from people already had pretty good access to care, a relatively small number of the uninsured. So we would love to see more movement, of course.
Right.
But it'll take a little bit to see that.
Yeah. Obviously, you don't want much of anecdotes, bad or good, but pay attention to the anecdotes. It's good to hear. I will say anecdotally, and I don't just mean through the media. I mean just in my own little world, people who I know. October, November, I heard a lot of stories about people, they weren't happy with the plans they were seeing. They couldn't get on. They got cancellations. And that turned around a lot in December. I started hearing a lot of really good stories. I still heard a mix, and I still now hear a mix, but I would say the balance of stories from people are better rather than worse. Now, whatever, everything's secondhand. I'm not investigating these, but whatever, pay attention to those. We'll want to see, I think, some indicators. It's a weird thing because, again, I don't. The insurance industry has its own agenda. As someone who has a very I want to be I'm fairly skeptical a lot of the time of a lot of insurers. At the same time, they're a leading indicator of how things are going. Are they freaking out? Are they not freaking out? Are they freaking out in ways that seem designed to push a political point, or are they actually freaking out in ways that don't? Are we seeing a lot of hearing a lot about confusion and problems and people not sorting out? Are we getting, what are we hearing from the social service agencies, from the clinics? I always find, if you want to know for people who are uninsured what's going on, clinics usually, the community clinics, they got ears to the ground. Legal services, people dealing with medical debt. Let's see what they're saying. They tend to be able to give you a reasonably good picture. So, watching that, and then, paying a lot of attention to different states. Let's see how, different states, or some of the states that are implementing this most aggressively are also monitoring things pretty aggressively. There's a lot of good information we're getting out of California about how things are going. That's part of what they're doing. So, let's see, Covered California, they've been transparent. They provide a lot of information. So I'll actually be watching California pretty closely because it's also, to me, California is a big state that is demographically similar enough to the country as a whole to give us a real picture, better than, say, a place like Vermont, for example. At the same time, California is a place that wants this to work. So at the very, I feel like that shows us how it can work even in a big place when they want it to work. And to me, that sets a realistic bar for the rest of the country. I don't expect every state to do as well because a lot of states don't want to do it as well and aren't prepared to. But, because there are going to be places where things don't go well, but it's important to me to say, well, all right, it does work here. So then it becomes a question of, is it possible to make it work there? And I tend to think it usually is. If it can work in California, it should work pretty much everywhere else if they wanted to.
One thing that I also am looking for is basically as we get towards March to see, when things start to be real. Okay, we know how many people have really signed up, and then insurers start saying, well, this is what we can do for our premiums for 2015. At the moment, everything that's happening now in the risk pool is really kind of lead in, and it doesn't really matter, but it will matter as we start to get into the in March, and insurers just have to make some decisions. And if insurers really raise their premiums for 2015, then we know they perceive a real issue. And if they keep the premiums kind of where they are now or in that ballpark, then we'll know that they're basically willing to live with the kind of risk pools that they're getting.
Yeah, yeah. Well, and the other big question here is we're going to go through a wave of small businesses transferring plans, and that's going to be similar to the individual market. And it will be interesting to see how that works. The small business market was already much more regulated in most states. So, you didn't have the difference moving from the old system to the new system is not nearly as dramatic as among people buying insurance on their own. On the other hand, you got a lot of small businesses out there, and some of the changes are the same. The big one is going to be, there are going to be small companies with really healthy people in them, who some of them are going to, discover that they're now in a pool with companies that have, older people, and they're going to have to pay more. The flip side is you're going to have the companies with the older people paying less. And I think it will be a test. Can the administration manage the transition a little better this time? Maybe a little talking to the insurance companies beforehand. Okay, what exactly are you guys doing? What can we do so that people know their options right away? That was a big part of the problem, was people were finding out they were losing their plans and didn't know what, and some of that was technological, but how do we kind of notify people? The flip side is small businesses are a little more sophisticated in general. If you're a small business operator, you deal with insurance, you have brokers. You're a little more operating with a little more knowledge than I think before. So, they can do that. I think, we'll see what happens. But, can they manage that better? And also, I think that's a challenge for the media as well. Look, people, I think we've talked about this before. There are real trade-offs in this law. There are people who are going to end up paying more for insurance or paying, or getting less insurance. And there are some people who, if you're looking simply at, they're young and healthy, look, pay more. And that's part of the trade-off here. And there's no, they're giving up something. And I might think they're better off in the long run. They're getting invested, but they are giving up something, and that's real, and that needs to be acknowledged. And they're not going to be happy about it, some of them.
So we all have to have a certain chastened and pragmatic perspective that takes into account that there's going to be many different people having many different consequences from this new law, and overall the consequences are very likely to be positive, but they won't be for every person and certainly for every anecdote. As we close out, I was wondering if you could just grab the picture behind you and show us what that is.
So this is let me put my window closed here. Okay, here we go. So this is can you get that? Can you
back up a little bit because there's a reflection, but that's one of my favorite pictures.
It is. This is a picture of the signing ceremony in 1965. This here is Lyndon Johnson. This is Harry Truman. This is when they signed the bill that created Medicare and Medicaid, which were created by the same law. Also increased, as you know, also boosted payments in the Social Security system for the elderly. A great day. One day I'll frame the one that you and I saw for the signing of the Affordable Care Act, which was also, I think, a very important, will go down in history, I hope. It's a similar way, but that's a good memory for me, so I always like to have that picture handy.
Well, it's a great reminder of just the fact that this is a long game, and Medicare and Medicaid weren't perfect in 1965, and actually took quite a while for many states to accept Medicaid, and so we'll see how this goes. But in any event, it's been, as always, wonderful to talk to you, and thanks so much for coming on Curbside Consult.
Anytime. I love these Curbside Consults.